15.2 Sports injuries. So in terms of sports injuries, there's two types of responses: the physiological and the psychological responses to the injuries. So first thing we're looking at is a strain. A strain is an injury that involves a muscle and tendon. It's caused by stretching or tearing muscular tendons, and it occurs at the point where a muscle becomes the tendon. Typically, a strain will occur when the muscle has to stretch and then suddenly contract, and so is common in things such as running and jumping, especially when a warm-up has not been done, and so the muscle isn't prepared for it. Typical symptoms of strains are pain, muscle spasms, limited muscle strength, and a limited range of motion. There's 3 different classes of strains: grade 1, which is a pull; grade 2, a tear; and grade 3, a rupture. In order for it to be classed as a pull, it needs up to 10% of the muscle fibres to be disrupted. At this point, there's a slightly limited range of motion at the joint with a loss of strength. There is a degree of pain, but not too much, meaning that a person can still carry on if they want to. A grade 2 tear means that 10 to 15% of muscle fibres have been disrupted, resulting in no muscle strength, extremely limited range of motion, and swelling and pain. The person will not be able to carry on playing due to the pain level, and it typically happens in colder weather when a warm-up hasn't been done before beginning exercise, so the muscles are very cold before they go into the motions. A grade 3 rupture is the most severe strain and affects 50 to 100% of the muscle fibres. The whole muscle tendon is ripped apart in this instant, and consequently the muscle shortens as it's no longer anchored to the bone, and this causes extreme pain for the person, allowing no range of motion, no strength, and very long healing time. There's also chronic or long-lasting strains which gradually build up from overuse and repetitive stress, such as tendinitis, which is quite common for runners and games players at the knee. So then a sprain, this is an injury that involves the joint and ligaments. It's caused by stretching or tearing a ligament and occurs at the joints of the body. A sprain will typically occur when the joint is forced beyond its range of motion. A common example of this is rolling an ankle when turning in football. So typical symptoms of sprains are pain, bruising, swelling, and the person will usually feel a tear or pop in the joint, followed by pain straight away. And then obviously the severity of the pain will depend on the severity of the sprain. So there's 3 different classes of sprains: grade 1, a stretch; grade 2, a tear; and grade 3, a rupture. A grade 1 stretch results in a loss of strength, but they will still have a good range of motion, relatively good stability, and will be able to carry on playing or exercising. A grade 2 tear usually occurs as a result of aggressive movement and awkward landings, and will lead to having a limited range of motion, no strength, and no stability at the joint, meaning that they can't carry on with the exercise. And a grade 3 rupture involves the ligament tearing completely, which results in no range of motion at the joint. The joint will be completely unstable, and they will be unable to move the limb. This would occur in a situation such as someone going over their ankle running at full speed, meaning that all their body weight and whole momentum apply a huge amount of force on the ligament. So a hematoma is a solid swelling of blood within the tissue caused by a collection of blood outside the blood vessels. It occurs when the walls of the blood vessel is injured, which causes the blood to seep out of the vessels into the surrounding tissues. So there's 2 types: intermuscular hematoma and intramuscular hematoma. So intermuscular hematomas are when the bleeding occurs within the compartments of the muscles, so the blood doesn't seep into the surrounding tissues, as can be seen in the left picture. And intramuscular hematomas occur in the same way, but the blood escapes into the surrounding tissues, making the bruise appear much larger than the actual point of contact. So usually an intramuscular hematoma occurs like when a lot more force has been kind of applied through it, an accident or injury. So there are 4 stages pretty much to the blood clotting mechanism. So when a tear in the blood vessel occurs, the platelets are activated and become sticky. They then stick to each other, as well as the side of the hole in the blood vessel, which forms a temporary plug. So then the clotting factors reinforce this plug, and they are activated as they pass the tear and begin to again stick to the platelets that are already present at the site. And this begins to form a web of fibrous tissue called fibrin. The fibrin acts like a glue that holds the platelets and clotting factors together. And then other cells that are passing through the vessel then get caught in the web of fibrin, which reinforces the plug, and the sides of the wound are pulled together. The clot will then stay in the hole until it is repaired, but it will then just dissolve when it's no longer needed by the body. So the fact that it's made up of things that are already in your body means it can just dissolve back into the blood. So there's 3 stages of to the healing process: inflammation, repair, and remodelling. The inflammation process is like the emergency response, and that aims to deal with the most dangerous effects. It lasts for around 4 to 6 days and causes things such as swelling, redness, and pain. At the point, the pain is constant and there is no relief from it, so no matter what you do, like moving positions, it's not going to help it, it's just going to hurt. So it attracts fibroblasts which bind the wound back together, and at this stage it's important to get nutrients such as omega-3 and 6 fatty acids, vitamin C and E into the body to help with that, the combating like the initial effects of it. So the common way of helping this phase is the RICE, so rest, ice compression and elevation. Rest prevents any further injury occurring, ice and compression reduces the swelling, and the elevation allows the swelling to drain from that area. The repair stage takes between 4 and 24 days, and this is where the inflammation has begun to die down and the body begins to repair the damaged tissues by laying down new collagen. But the new collagen fibres are put down fairly randomly, which results in the scar tissue that most people find that builds up over a while. So this scar tissue is weaker and less flexible than the normal tissue around that area. And at this point there is less pain, however there is more chance of re-injury occurring as the new collagen fibres can't withstand as much stress as the normal tissues. And it's often at this point people will return to their regular physical activity too soon because they feel fine, even though like the fibres aren't actually laid down properly yet and they haven't built up their strength. So physio is usually focused around regaining the range of motion and building strength within this stage. The last stage is the remodelling phase, and that's from around 3 weeks up to 2 years. At this point, the cellular organisation of the collagen fibres is the main focus, so along with strengthening the bonds. This is the point where stress is now needed in order to help realign the fibres, meaning that they'll be able to withstand more pressure on the tissues in the future. So that's where they start kind of putting more kind of intrusive exercises like around the area of the injury just to try and strengthen it and get it ready to be able to be used for actual sporting use and just kind of everyday use. So physiotherapy is used in this stage in order to help regain a full range of motion as well as improving strength through eccentric resistance based exercises. Now moving on to the psychological responses to injury. So there's the 5 stages of grief. An athlete might not go through all 5 stages, and they'll go through each stage at potentially different times in a different order. There's no set way of going through it. The denial and isolation stage is the first response to an injury. It's often where they don't yet accept reality. They're faced with an overwhelming number of emotions and they're unable to process them in a safe way. Often an athlete will also not accept the severity of the injury and they will think that what they've been told is wrong or just can't be true, so often they'll be seeking to get second opinions because they can't accept what they've been told. As a person begins to understand that they are injured and the severity of that injury really, the reality of that, the emotional distress that accompanies that returns. So this emotional pain is often redirected as anger, whether this is directed at an inanimate object, strangers, friends or family. Often a person will direct their anger towards someone despite the fact that they know they're not to blame. They're just angry at the situation they found themselves in and they don't know how to get it out necessarily. Then they'll also often feel guilty for the way that they're reacting, which kind of fuels their anger even more. The bargaining stage often involves the athlete trying to speed up their recovery process, which will often mean putting themselves more at risk. They might try to cut corners or find their way around things so that they can get back to training and competing again. So they might be like, I can carry on training as long as I strap it or as long as I do this or that, when in reality that's not the case. They're just going to injure themselves further. So then often athletes will find themselves feeling depressed once they have confronted reality and actually realise the consequences of their injury. They'll often become despondent and uncertain about the future and what it might hold. This can be more prominent for athletes who are part of a team. They may not be as involved within the team and feel more isolated than before, like missing out on going to training and not knowing whether they'll ever return to playing with the team again. And then the final stage is acceptance. This is where the individual has started to move towards an admission of the injury. At this point, they begin to focus more on their rehabilitation and returning to their sport. This is often where they transition from an emotional stage to a coping stage as they realise what they need to do in order to aid their recovery. So there's 9 emotional states of mind that an athlete might find themselves going through when dealing with their injuries. So fear, that will often come before any form of diagnosis has been given. An athlete will probably fear the worst, not knowing how severe their injury is or how long they'll be out and whether they'll ever return to their sport at all. Similarly, someone might experience fear after the rehabilitation process when they're returning back to competition. So like if it's a footballer, they might not want to go in for rough tackles in fear that they might injure themselves again. Frustration often sets in later on, sometimes days, weeks and months after the injury. After the diagnosis, once they've actually accepted the severity of the injury, they'll commonly become frustrated at the situation, whether it is that they're frustrated with their injury, their rate of recovery, or just the fact that they cannot do what they would normally do. And this is often where the what if kind of thoughts set in. Isolation often occurs weeks or months after an injury when a person is unable to attend their regular training. They begin to feel isolated as they aren't seeing their friends and teammates as much as they would used to, and they're losing that social aspect that they've become so accustomed to. So if you've got an athlete who's training 5 days a week with their team and then they're now not able to train at all, that's a huge thing to take away from them, and it's very hard for them to cope with. So naturally athletes will begin to lack in motivation. This will usually occur weeks to months after the injury occurs. Often when an athlete can't see that they're making progress or don't feel like what they're doing is making a difference or a significant difference, they'll begin to lose hope and feel less motivated, meaning that they might put in less effort with their rehabilitation and will become disengaged. And that can prolong the recovery process or mean that they never really get back to their full strength again. Usually athletes will experience anger at the time of the injury and the days following. They may be angry if the diagnosis is worse than they thought, or alternatively they might be angry towards whoever could have caused the injury. So if it was a tackle in football, they'd be angry at the other person involved and will try and find someone to put that blame onto. In certain cases, a person will go through a phase of depression which usually sets in weeks or months after the injury. This is usually due to their lack of involvement within their sport or team, the fact that they might be physically immobile, or because of the fact that they can't keep training and improving and instead might lose fitness they've gained through their regular training, so they might feel like they're taking steps backwards and forwards. Anxiety is an emotion that will often go through immediately after the injury before they've been given a diagnosis. This is usually because they don't know how severe the injury will be and they've got a lot of unanswered questions, usually in regard to how long the recovery time will be and what the rehabilitation process will entail. Denial will often occur at the time of diagnosis and the following days after the diagnosis. During this, they'll usually carry on playing or training and will pretend that they're fine, and this can often put them in danger of making the injury worse. Typically, after the athlete has gone through the rehabilitation process, they'll be lacking in confidence because everyone's carried on training, obviously, whilst they've been at home or just working on their rehabilitation. So they might feel as if everyone is better than them, and they're going to look down on them. They're not as good as they once were, and so they're probably going to feel a bit less confident going back into their sport and competing at that same level. So there are 4 responses to treatment that may either help or hinder the recovery process. So anxiety, experiencing anxiety as a response to treatment has a number of pros and cons. So on the positives, someone who is anxious won't want to take any risks and so will play it safe, which will likely lead to the best path of recovery. They're not going to take shortcuts and will do everything as they're meant to, which should reduce the risk of further injury occurring. The fact they're so anxious may make them more likely to go and research their injury, and so they'll become more knowledgeable on it so they can know themselves other ways to help it and how to prevent it in the future. Once they acknowledge that they're anxious, it might make them want to change their mindsets and completely kind of saying enough is enough, I don't want to feel this way anymore, I want to get back in control of what's going on. However, anxiety can lead to loss of sleep, which will make them feel worse and could limit the rehabilitation process if they're not getting enough sleep. They may turn down treatments as they're worried about them, which could delay recovery time. They might put things off, constantly saying that they're going to do it tomorrow. And they might also be anxious that they're not hitting their targets, which will make them more anxious and less likely to hit the rest of their targets because they're stressing so much about it. Although frustration is usually associated with negative things, it can have a positive impact on recovery too. So it might encourage a person to try other treatments, which they might respond better to if they're finding that a certain one they're trying, they're not getting anywhere with it and they're starting to get annoyed, they might go ahead and find something else. And it does show the care and commitment they have to their sport and the fact they want to get better and get back to playing. However, it can lead to them giving up treatments if they find it's not working, they just give up before it has a chance to actually do what's meant to do. And they might lose motivation, and then that could lead to them giving up on the sport altogether. Often people think that being motivated can only be beneficial. However, there are circumstances that can lead to it having adverse effects. So being motivated can make a person try harder and put more effort into their rehabilitation and training because they want to get back. And it can make them more excited to get back, so keep them focused on the end goal, knowing what they're striving for and why they're doing it. However, it can cause them to possibly train too hard, which could result in injury. They might set themselves unrealistic goals that they can't achieve, and then once they're not achieving them, they'll find that disheartening and might kind of lose focus and start to not bother. And they might just rush their recovery, trying to get it all done as quickly as possible, and that's not the case. It needs time, and that could lead to more injuries, so more time out. Goal setting is very common for athletes trying to get from one place to another, in this case from injury back to full strength. So the good points about goal setting is that it allows a person to take baby steps. They can set little goals along the line so they can achieve those and make little changes and get better slowly. It can help them stick to their rehabilitation program, knowing that they've got these things to work towards, they know what they're aiming for, and the overall kind of summary of the rehabilitation program. And it gives them something that they can visibly work towards or work at. And there's also the option of using SMART targets. So this is specific, measurable, achievable, realistic and time-bound goals. And you've got the option of having short, medium and long-term ones. So knowing a long-term goal, knowing where you want to end up eventually. Medium-term, knowing like kind of the steps between now and then. And short-term, like the kind of more immediate goals you can achieve in this short space of time. However, there are some downsides to goal setting. Sometimes a person will set themselves unrealistic goals because they feel like they can achieve a lot more than they can. And then they might not achieve these goals, and that will be very demotivating for them. They might feel a lot of pressure on themselves to meet the goals. And for people with like really severe injuries, they might not be in the stage where they can set themselves goals yet. That's not realistic for them. So there's different strategies that people might use to help them cope with their rehabilitation and facing their injuries. So relaxation, this will include things like yoga, meditation and stress balls. It helps to release stress and relax both physically and mentally. Music, so people will have different playlists and types of music to affect their mood, like whether they want to motivate themselves, whether they're in a sad mood, a happy mood. And this can allow consistency. You can listen to the same music every time you do a certain thing. So if you had a set playlist every time you're doing your rehabilitation, it can just help to motivate you and put you in the right mindset for doing that. Imagery and self-talk. This is used to motivate yourself and to change your mindset by changing thought processes and getting rid of negative thoughts. And imagery allows you to keep focused and picture yourself at the end goal, and it can help you to strengthen the neurological pathways without physically doing any exercise, as if you're familiarising yourself with situations that you might face in real life, so you're prepared for when you do go back to sport, and when you're able to, when you put yourself in those situations, you'll know what to do because you've thought about it already. A diary can be cathartic to express people's feelings and release any possible thoughts they might be bring them down. So it's a way of releasing any negativity. And someone can also look back through their diary to see patterns and progress, not only physically but also mentally, and see how your mentality and mindset has changed through the rehabilitation process. And then involvement, probably quite an obvious one. So you don't have to be physically playing a sport in order to stay involved within a team. There's always the option to spectate or assist with coaching and training sessions, stuff along those lines. It allows you to feel involved in the team still and avoid isolation. It's often a good idea to go to training sessions and perform your own physio training whilst people do their normal training. And that allows you to feel included in the team and add to some consistency within your rehabilitation. So the first case study got Leanne Sanderson, a professional footballer who suffered a torn ACL at the knee. So this would be classed as like a grade 3 sprain at the knee due to the ligament damage. So this would have caused these physiological changes on her body, and the treatment of this would have basically been having an MRI, surgery, and then go through the rehabilitation process. So at the time of the injury, she would be experiencing a lot of fear, not knowing how bad the injury is, because obviously she wouldn't have a diagnosis at this point. She just knows she's in a lot of pain. Anxiety, fearing the worst, lots of questioning running through her head, because obviously this is her full-time career as well. So she could essentially be out of the job if the injury is bad enough. Frustration, obviously having to come off during the game because no one really wants to come off when they're playing, and so she'd feel quite frustrated at that element, I would imagine. After getting the diagnosis and finding out what's wrong, so frustration that she can't play, because obviously if you're a professional footballer, football is going to be your passion, so the fact that's taken away from you is going to be very frustrating for a person. Feelings of anger, possibly towards themselves for allowing it to happen, even if that's not necessarily a logical response. They might just still feel that anger towards themselves for, like, maybe saying, like, why didn't I do this differently, why didn't I do that? Or alternatively, if it was like going in for a tackle, anger towards a person who they went in the tackle with. So probably a sense of denial at first, maybe not accepting the severity of the situation, thinking they'll be back in like a few weeks. Anxiety, not knowing whether they're going to make a full recovery or not, because obviously as other athletes who maybe have had worse experience of like ACL injuries, and for a lot of people it can like end their career, so having that uncertainty on whether they're going to go back or not, and again seeing as this is their full-time job, that could mean they don't have a job anymore. And the isolation element, knowing that they're not training with teammates. So for strategies, I thought music would be a good one, because you've got music wherever you go really, and you can use it throughout the entire rehabilitation exercises and process, finding certain songs that might motivate you at times when you're feeling down, and it can be used to just counteract moods. So if you're feeling down, get songs that bring you up, and if you're feeling up, maybe listen to more songs that's going to like heighten that mood to put you in a good place. Involvement, so attending training, doing the rehabilitation exercises at the same time as everyone else doing their training, still attending things like match analysis, which is going to kind of linking with imagery, because learning about what things need to be done better in game situations, so they know when they're coming back what they need to get on top of, things that they can work on when they're back. So self-talk, so like kind of when you're getting yourself in a rut, like disposing of the negative feelings and comments. And this can also be good for when they're returning back to competitions, because there's going to be niggling thoughts of doubts once they're back. So if they can dispose of those quite quickly through self-talk, that'd be very beneficial. And relaxations, so that's quite cathartic and stress relieving. So things like yoga will aid with rehabilitation as well, because it will help to maintain some strength and fitness levels too. Because obviously they're not training to the extent that they could be before, so it's good to make sure they're keeping some form of exercise as well, for both the physiological and psychological benefits that come with that. So case study 2, Karen Barnsley, the England goalkeeper with a fractured fibula. So again, as you can see, the physiological things that come alongside this would result in the process of having an x-ray, a cast, and then going through the rehabilitation process. So for this case, at the time of the injury, there'd be a lot of fear, like not necessarily knowing what happened, because in a sporting situation sometimes the adrenaline is taken over, everything happens very quickly, you're not too sure what's gone on, you just know that you're in pain and you're on the floor. Frustration, because she had to come off during the game, that was during the Euros 2017, so that's a big competition that she was going to potentially miss out on a lot of. That was kind of like her section cut short of that. And a lot of anger, because in this situation it was a collision with someone on the own team, so the fact that there was someone like that they actually play alongside could be quite they might be quite angry towards them, because they might blame them. However, after getting the diagnosis, so fear of the fact they're missing out on the Euros 2017s, and then again not knowing whether they're going to make a full recovery or not, and knowing that could impact their career quite a lot. Isolation and missing out on time with the England squad, because that's quite a big privilege, and the fact they managed to get picked for it, but now that's being taken away from them, so they're going to feel quite isolated, not having that bond with the girls. Bargaining, so in this situation she did try and play on in the game, and she probably would want to carry on trying to be part of the competition if possible, so being like, oh, maybe if I just rest it for these days I can go on and play this game and this one, or just playing like 10 minutes whatever of a game. Anxiety, so not knowing if she's going to be selected for the squad again after rehab because other people will have carried on training and had more game time than her after this. And anger, because it wasn't her fault that she got injured, it was the kind of fault of other players. So for this, the strategies I thought would be music, as again it's quite consistent and practical, can be used during the rehab to kind of make some familiarity in terms of when they're doing certain exercises, how things make them feel, and having things to motivate them through the rehabilitation exercises. So involvement, so still supporting this team through the competitions, and maybe helping other goalkeepers with their training and like match analysis, just giving tips to the other girls and like helping them out where she can. Self-talk to get rid of the negative thoughts. Again, coming back into the competition afterwards, you're going to need to have the ability to self-talk and lift yourself up when you might be feeling down. And again, imagery to reinforce the neurological pathways and increase their mental strength as well. So knowing how they're going to react to certain situations when they come back to the game by watching the girls and knowing what they would and wouldn't do in certain situations.